So good morning, bonjour. As you heard, I'm Sasha Nadeau, the new Director of Programs and Services, and it is my pleasure this morning to introduce our keynote. Formerly a colleague of mine at Geriatric Medicine Research Unit at the Veterans Memorial here. He's also a former Alzheimer Society Research Program winner, postdoctoral student at Dalhousie University. Josh is a research scientist with the Alzheimer Society of Canada, and while he currently lives in Thunder Bay, Ontario, he is delighted to be back in Nova Scotia. He's a jack of all trades with a multidisciplinary background in health sciences, with research expertise in data analytics, gerontology, epidemiology, health measurement, and public health. Prior to his role, he was a prof at Lakehead University, and as a fun fact, beyond academia, Josh is also a certified beer judge. So with that, we will welcome Josh this morning to talk to us about the landmark study.
Hello, thank you for having me. It's great to be here back in Nova Scotia. Can you hear me okay? I'll try to speak into this microphone. So I'm happy here to present some work I did with the Alzheimer Society of Canada, the landmark study. As we all know, population here in Nova Scotia and Canada and all around the world are aging, and with age comes higher rates of dementia. Well over 600,000 people in Canada currently live with the condition, and we expect this to increase fairly rapidly in the upcoming years. There are many different types of dementia. Dementia is an umbrella term. This ranges from Alzheimer's disease, vascular dementia, frontotemporal dementia. But what we now know is that as people get older, it's not easy to put people into boxes. It's actually more so mixed pathologies that people's brains suffer from, which leads to the condition that we know as dementia. You might notice if you read the report that we use the term Alzheimer's dementia, not Alzheimer's disease. Technically, Alzheimer's disease is the changes that go on within the brain that happens with many people. Alzheimer's dementia is more so the clinical presentation of those changes within the brain. So in the report, we use the term Alzheimer's dementia because we're talking about that presentation of these challenges that we know of, not so much just the changes in the brain. This is important to be accurate what we're talking about, what we're reporting. You see the numbers, but also because we now know that people can have changes, Alzheimer's disease changes in their brain, and not express those changes. So we need to better understand why some people might develop these cognitive issues and some people don't, despite having these negative changes happening within their brains. If we look at the risk factors for dementia, the number one risk factor, or the primary risk factor, is age. But it's not a normal part of aging. You can get into your 80s and 90s and still remain sharp as a tack. So it's not a normal part of aging. We still don't fully understand the mechanisms behind what leads to dementia. Researchers have discovered a number of different risk factors on top of age that put people at a higher level of risk. Some of these things we can adjust, some of these things we can't deal with. So here we listed a table of just some of the risk factors that we do know from the research that lead to higher risk of dementia. And it's best to kind of think about them, how they might impact you across the life course, from education at an early age, to your health in midlife, to other also factors once you get into your later years. So for the landmark study, we took a micro-simulation approach working with the Canadian Centre for Economic Analysis, or CanCEA. Here, we use computer to simulate the Canadian population. We take data from Statistics Canada, that includes age, sex, and ethnicity, and we use that to better understand how the population is now and how it might change going forward. Onto that, we can map on risk factors for dementia and dementia status itself to get a better sense of what we might expect over the next 3 decades. This approach allows us to look at differences between sex, get a better understanding of ethnicity and how dementia is reflected in the different populations, look at provincial differences, and also account for population dynamics, things like immigration, but also death within the population. So we can use this model to try to estimate or project what we would expect over the next 30 years, and I'll present some of those findings here today. Another neat thing about this kind of simulation approach is that we can artificially push off the risk of dementia by 1 year, 5 years, or 10 years to get a better sense of how that might impact the dementia numbers across the country. So today, I'm going to be talking primarily about the first report, Navigating the Path Forward for Dementia in Canada. But we have 2 more reports coming out from the landmark study. The first report you have in your bag, but you could also find on our website if you lose your copy. We have 2 other reports coming out. The next report is going to be looking at the people who experience dementia in Canada in the next 30 years, with closer examination of sex differences, ethnic differences, and also young onset dementia. The final report will look at the economics, so putting the dollar figures to all these statistics that we're talking about here today. So to begin, I want to just cover some of the material from the first chapter of the report. So we look at this table, we contrast the numbers in 2020 with 2050. In 2020, we were just under 600,000 Canadians living with dementia. By 2050, we're looking at numbers over 1.7 million. This is a 187% increase, or almost a tripling of the numbers over the next 3 decades. If we look at 2020 numbers here in Canada, we're just over 660,000 people living with dementia. We call this prevalence. And in terms of incidence or new cases, we are almost at 135,000 every year. Well, for 2022, that's the estimation. For Nova Scotia, we're over 6,000. We estimate over 16,000 people currently living with the condition, and 2,700 new cases expected this year alone. Now, there's several factors that lead to these numbers over the next 30 years. Primarily, with age as the biggest risk factor for dementia, it's the aging of the population. We've all heard about the baby boomer cohort, this largest kind of section of the population that's driven a lot of what we see in our society over the years, and they will also be driving these dementia numbers as they get into their 70s, 80s, and 90s. Those of baby boomers now are just in their mid to late 70s. By 2050, all these baby boomers will be over the age of 85, hence kind of the pushing up of the numbers. We're also incorporating evolving immigration patterns with many more older adults coming to Canada, and there's changes in population level risk. You might have heard that there's been a bit of a reduction in incidence of dementia in Canada around the world. This has been incorporated into our model, but because we have such a large older population, we're still going to see the numbers increase over the next 30 years. Now, what I present to you today is not, I don't have a crystal ball. I don't actually know what the future is. These are a model, and it has a projection of what we expect. So we take the best data that we could find, looking at our population and looking at understanding dementia, incorporate it, and try to understand what to expect down the road. But we don't know what might impact these trends. People always ask about COVID and how COVID might impact these numbers. COVID is not incorporated into the model, and I can't tell you what might happen. How about climate change? We don't know. Or what if maybe there's a pharmaceutical agent that helps reduce these numbers or delay onset by a great amount? We don't know that, so all that we can do is take current trends, try to understand how that might look going forward into the future. Press the run button, sorry. So here I have a slide that captures what we expect over the next 30 years. So the figure on the right, the dark blue bars are the prevalent cases, or what the number of people living with dementia. And the light blue bars at the bottom, those are the annual incidence, or number of new cases that are expected to occur each year. If we were to add up all those new cases over the next 30 years, we are looking at over 6.3 million Canadians developing dementia. If you look closer at those light blue bars, in the 2040s, that number gets to over 250,000 diagnoses each year. To break that down, that's 21,000 diagnoses per month approximately, 700 new diagnoses each day, or 30 new cases every hour in Canada into the 2040s. And that's why we're seeing those numbers continue to go up and up and up, up towards 2050. Looking at Nova Scotia numbers, here we're looking at the number of people living with dementia, the change over time, broken down by sex. As you can see, women experience much more dementia than men at a rate of almost 2 to 1. This is the case across all provinces in Canada and most developed places in the world. There's many reasons that might explain this. Primarily, it's driven by the fact that women tend to live longer, and with age being the highest risk factor, that kind of leads to this difference. But there's many other sex differences that need to be better understood when it comes to dementia. Here, this is a figure looking at the change in incidence in dementia over the next 30 years in Nova Scotia, starting off at just approximately 2,500 every year currently, and by the late 2030s, that number is surpassing 4,000 every year. So 4,000 new cases every year in Nova Scotia for extended time period. But you do see that that curve starts to go down based on the population dynamics that are expected in the province. This figure here looks at contrasting 2020 numbers with 2050 numbers, but breaking it down by age. So the blue bars being 2020 and the orange bars being 2050. And you can see where a lot of the growth comes from those older age brackets, 75 plus. So just, again, contrasting the change in numbers that we'll expect from 2020 to 2050. Next, I want to move on to the second chapter where we looked at care partners. Another neat thing with this simulation model, because we simulate the entire population, we can also look at relationships and I try to better understand the number of care partners for people living with dementia as well to get a better sense of what those numbers look like. As we all know in this room, hopefully know in this room, most people with dementia live at home. Often, if you talk to, when I talk to students, they think of people living with dementia being placed in long-term care homes, but no, the majority do live at home. We know this from these statistics that I'm sharing here that come from the Canadian Institute for Health Information. Many people can live well with dementia, but often need support from friends, family members, or neighbors. We often call these people informal caregivers or care partners. Care partners primarily are family members or neighbors or friends. They can be often the adult children of people living with dementia, and they provide ongoing care for those who do have the condition. Care partners play a very important role in taking care of people living with dementia. Based on statistics from Canadian Institute for Health Information, care partners spend on average 26 hours a week providing care to older adults with dementia. So we use these statistics in building our model and try to better understand the number of hours that are provided to these individuals. Many care partners find their experiences rewarding, but it's also important that caregiving can have a negative impact on the health and quality of life of that care partner as well. Many different types of support that care partners do provide to individuals. This can range from day-to-day care, self-care, all the way to managing the household, and a wide range of other things that they do to take care of that individual. This is on top of their own lives and responsibilities, taking care of other family members as well. Often, if you have an adult child taking care of a parent, they also have children to take care of as well, further making the role challenging, more challenging. So in terms of numbers, in Canada, we can estimate that in 2020, there are approximately 350,000 care partners for people living with dementia. And by 2050, that number, again, almost triples to over 1 million. If we try to take those numbers, and we do the math by looking at the number of hours that they provide, that is the equivalent in 2020 of 235,000 full-time jobs. And when you get over 1 million care partners, that's the equivalent of 690,000 full-time jobs. So a whole bunch of work and effort goes into taking care of people with dementia in Canada. We hopefully can recognize that and provide supports and resources for these individuals. Here in Nova Scotia, the estimate is at 9,000 for 2020, and by 2050, that number increases and almost doubles to over 16,000 individuals. So it's an 87% increase expected over that time frame. We can also look at care partners and break them down by age. And here again, we're contrasting 2020 with 2050. 2020 being the blue bars, 2050 being the orange bars. And you can see a lot of care partners are of working age, which means that they're stepping away from the economy, away from their work, and taking care of their family members or loved ones. So not only does it have an impact on individuals, it also has an impact on our society as well. So something to recognize and look at as we move forward. The third chapter of the report focuses on dementia risk reduction. Dementia is often described as a public health challenge that nothing can be done about it because it's due to the fact that age, and we can't really control age, but that's simply not true. It's false. Research has clearly demonstrated that there are actions that we can take to try to reduce the risk of dementia. Some factors like age, sex at birth, genetics, can't really do much about that. You can't pick your parents. But there are a wide range of modifiable risk factors where we can do something about. This list has started off small and continues to grow all the time. More research keeps identifying different factors that are associated with increased risk that we could do something about. It's important to not think of these risk factors individually. We as humans are fully connected. Our brain and body are all linked. All the conditions don't impact just a singular organ system. We need to kind of think about risk factors across the whole body. We know anyone that works with older adults knows that they are at risk at a range of different conditions, range of different health issues. Dementia seldom travels alone. So when we're thinking about risk factors, we shouldn't think about them just as dealing with one risk factor at a time. We need to think about them all. Scientists are just beginning to start to tackle this. And if you look at the data, it shows that on top of the risk kind of given by individual risk factors, if you have more than one, that increases your risk even more than just a simple addition of those risk factors themselves. This is something that I'm really interested in and hope we can develop our understanding of. We also need to think about frailty, which kind of captures that idea of multiple health issues happening. What the research has shown, a lot of the research coming out of Nova Scotia here with Dr. Ken Rockwood, has shown that people who are more frail are at a higher risk of developing dementia. So that means when we're thinking about risk of dementia, we need to really consider overall health and frailty levels to try to understand people's risks. Researchers are also beginning to understand how frailty might help us better understand this relationship between what's going on with people's brains and that expression of the dementia. So the frailty might kind of explain why some people might develop these changes in the brain but not express dementia as they get older. So to try to better understand what the impact of dementia risk reduction might have, we've developed these hypothetical models where we were able to delay onset of dementia just mathematically. This is a simulation. We push off onset by 1 year, 5 years, and 10 years. And how does that impact these numbers that we're looking at? If you look at the table on the slide, a simple 1 year push off of dementia in Canada across the population would allow almost 500,000 Canadians not to develop the dementia over the next 30 years. A 5 year push off, we're looking at even bigger numbers, and 10 years, over 4 million. So there's a lot of power in dementia risk reduction. We were able to do the same thing. We could look at these numbers for the caregiver hours. That's the figure you see in the bottom part of the slide. And you can see if we were able to push off dementia by 10 years across the population, we were looking at saving tens of millions of hours of care and keeping the level of care almost steady across the next 3 decades. It's important to note, though, we did this mathematically. This isn't something that we don't propose that one single thing did this. But as I've hopefully clearly talked about, there are ways to reduce dementia risk in the population. Here, this infographic from the report takes data from a Lancet study from 2020. It's a major publication in dementia risk reduction or dementia prevention that looks at globally, if we address these 12 risk factors, you could actually reduce the prevalence of dementia by 40%. So these are global numbers and global risk factors. Maybe we need to take a bit closer look at what's going on in Canada or here in Nova Scotia to look at what risk factors we experience most and maybe try to tackle those ones first to have a greater impact on the population. While it's great to think about risk factors, you could also flip that in contrast and think about protective factors as well. So not only trying to avoid bad things, but what are the good things you can do to reduce your risk of dementia. We think of these as actions that you can take for brain health, and we've included a simple list of 12 different actions that you yourself can do to improve your brain health and thereby reduce your risk of dementia. If we look at just the Nova Scotia population with the same delay in onset model, these delayed onsets are associated with fairly large numbers even here in Nova Scotia, with up to 70,000 cases avoided if we were able to push off dementia by that 10 years. That might be way too optimistic. 10 years is a long time, but simple things as education has been shown to delay onset by 5 years in studies coming out of Chicago. So if we are able to tackle not just one, maybe two, maybe three different things, that's when we might see a greater impact on our population. Again, still looking across those delay in onset scenarios. The first two bars, that's broken up by male and female, looking at the current trends. This is the number of people living with dementia in the province. A 1-year delay slightly reduces those by 2050. By a 5-year delay almost brings it back to what we are seeing in 2020. If we were to do a 10-year delay, we'd actually see numbers in 2050 much below what we are currently seeing. So just again, trying to emphasize this power of dementia risk reduction and the delay in onset. The fourth chapter, we've broken down it by province because we do have provincial data, as you're aware. I've been sharing Nova Scotia data. But we thought it was important to look at what are the differences across the country to get a better understanding of where these cases might most fall. So here in the bubbles, we're contrasting 2020 with 2050 again and looking at the percentage increase in numbers that are expected over that time period. From coast to coast, we're expecting fairly large increases. We see less increases here in Nova Scotia and the Atlantic provinces because we already have an aging population here, and so the change isn't as strong. But we're still seeing almost a doubling of cases over the next 30 years. So it's important to address it from coast to coast to coast. And for the fifth and final chapter, just a summary of Nova Scotia findings. We're expecting to see this increase over the next 30 years of almost doubling the numbers. 15,300 in 2020, up to almost 30,000 by 2050. Hopefully, with today, I've demonstrated that the importance of trying to reduce risk, and we can try to push off back onset to have an impact, not just on the individual, but on our population to really shift what we're seeing across our communities. So a 10-year delay would allow almost 70,000 people to not develop dementia in Nova Scotia over the next 30 years. So this, again, stressing the importance of dementia risk reduction. The report concludes with a series of recommendations organized by different sectors, from federal government to provincial governments, to what individuals can do. When we're looking at those, we can think about how we don't really expect a cure or a really effective treatment to come anytime soon. At least I don't really see that coming. But it's important to try to take a wide range of actions to reduce the risk for the population and also optimize the health of those currently living with dementia. So we can look at things like fully funding and implementing the National Dementia Strategy. And I don't believe Nova Scotia has a dementia strategy, but maybe that's something that we need to start thinking about and working towards. Not an easy thing, but as we see the numbers ramping up, we should probably get in front of it before it's too late. We also need to start thinking across all the different healthcare systems and plan for further spending and further human resources in home care, social supports, long-term care. We also need to think about the care partners as well. We need to build up systems of interventions designed to help them not only provide optimal care to people living with dementia, but also so they can take care of themselves and support their own needs and their own health. We need to try to integrate these modifiable risk factors for dementia across health promotion strategies. I would like to see a lot more emphasis on brain health. I think it's a little sexier to talk about brain health and dementia risk reduction for those in their 40s and 50s and 60s. So maybe that's something we need to see happen. And also we need to build up dementia-friendly communities and facilities and programs and services, as we know we already have a lot of numbers and those numbers are going to keep coming. So let's get in front of it and really design our communities so it's friendly for everyone, including those living with dementia. So we have two next steps. So we have, like I mentioned, we have two further reports coming down the road. The Many Faces of Dementia in Canada, focusing on the people that will be developing dementia over the next 30 years. Here I'm sharing a little sneak peek, breaking down 2020 with 2050, by ethnicity. One of the biggest changes we're seeing in ethnicity is that currently, well, in 2020, we saw about 8% of the population of people living with dementia were from Asian origins. By 2050, that goes up to 24%. So by 2050, 1 in 4 people living with dementia in Canada will be of Asian origin. So we see a growing diversity in older adults. We're going to see a growing diversity in people living with dementia. We need to kind of think about what that means in terms of care and support. The final report coming out maybe fall 23, maybe 2024, but looking at putting numbers to this data. So we started out with these numbers that you saw today, hopefully put a face on those numbers with the next report, and then throw in some dollar bills on top to understand what the cost will be. So this is Sasha. Thank you. That's it for our presentation. I think we have a roundtable discussion to follow.
Wonderful. Thanks, Josh. So I've heard those numbers probably 30, 40 times since August, and they still hit home every time. I know that's some big data to digest for the audience. So what we thought we'd do now, since we're back, we thought it'd be a really nice chance to do a round table. There'll also be some engagement in the chat for our virtual folks. An 87% increase in Nova Scotia is a lot to think about. So what we'd love you to do at this stage, we're going to have a little 5-minute roundtable discussion, just going around your table, chatting about what these numbers could mean for your role, for your organization, your work, just reacting to them generally. And the other thing we'll show, Josh introduced 2 tools, so an infographic and a list of actions people can take. Let me just click for it. And you can find those for anyone with their conference bags. You'll have a copy of the landmark study, aussi disponible en français, so if you'd like a French copy, let us know. And on pages 35 and 38, you can see these tools. So again, we'll have the next 5 minutes, chat amongst yourselves, introduce yourselves to your table mates, just think about what these numbers could mean for our roles, our work, and have a chat if these tools might be helpful. We'll see you back in 5 minutes for a Q&A with Josh. We hope you had some fruitful discussions at your tables, that it's nice to be networking again. I also hope it was a nice little icebreaker to decide what questions you'll ask of Josh. So now we have a few minutes of Q&A with our keynote. You'll see there are 2 microphones in the room. We also have staff runners if anyone is not interested in speaking at the mic and would prefer to write their question. And our virtual audience can submit questions as well, and we'll be curating those. So with that, I'll step back, see if there's any comments or questions for Josh.
Hi there. It's amazing how much work you've put into this, and it's great that you've done that. What we're looking at is a major societal shift here. We already have a lot of stresses in our lives. We have a lot of stresses on our health system in particular. Imagining a doubling of the incidence of dementia is really troublesome. We have to do something about that. It's going to be catastrophic, it seems to me, if the numbers that you're predicting actually happen. So we have to start now, and we have to really focus on reducing that, the numbers year after year going forward. So thank you for bringing this to our attention. What can we do to make sure that all of the people who need to know about this stuff are informed? Government, business, communities in general, etc. Have you got some thoughts around where you're going to take this landmark study? Thank you.
Sure, thank you for the question. There's a lot of work to be done. Obviously, talking about it and looking at research and finding more about the disease and sharing this with your friends and family can start to address it. This is what we're trying to do with the Alzheimer's study, is try to advocate for change and try to get in front of things. We don't like to use like the cast front of like that kind of language a lot, because maybe systems might break down, but we're not there yet. Let's get out in front of it and try to plan for this change. We know it's coming. We've talked, like when we first started working on this report, we've already knew the numbers were coming. So for us, the numbers aren't that surprising. So it's more so the numbers that we see with the dementia risk reduction, that's the exciting part, where we can see if we do effectively try to address this challenge, we can reduce those numbers. I'll stop there. Thank you for your question.
Hi, Joss. I have, maybe it's a little bit of a technical question, but I'm really curious about the caregivers chapter and the fact that there's like 58% of those caregivers are adult children. Right now, there's, 32% I think are spouses, and then 10% are others, friends, neighbors, etc. So my question is, these are doubling and tripling as well, but where are they? Like, who are they? Because in terms of your modeling, because right now, the baby boomers, right, who are many of the caregivers, are adult children, and there's a lot more of us. But, I always use the example, I'm one of 9 and I have 1 son. There's an issue there, right? When something happens to me in terms of availability of caregivers. So I'm just curious, when you say they're doubling and tripling, who are they going to be?
It's a solid question. I don't have a full answer for you. So we take the best data that we have, and there's not a lot of good data on care partners or caregivers, so we kind of struggle with that. A lot of people also point out the fact that those numbers are much smaller than the number of people living with dementia, so why isn't it a one-to-one relationship? In our modeling, we say basically, once you enter long-term care, you no longer have a care partner. So these are because that's not the truth, really. So these are very conservative estimates. They actually don't even capture the reality. And to your point, this demographic challenge, definitely we're facing that not just in the dementia world, but across all aspects of society. We will experience it here. Places like China will experience it at a different level due to the policies that they've had. So definitely challenging times, but like we talked about, let's get in front of this. Let's plan for it rather than then react to it.
Good morning.
Good morning.
My question is, I'm the caretaker. My spouse has been diagnosed with Alzheimer's in April. Maybe a mistake that we all make, but I think it's human factors. We go online and do a lot of reading, and some of it is encouraging, and obviously some of it isn't. I was wondering, I see on the internet often in different countries have different medications that they claim can slow the progress, but we don't hear a whole lot about that in Canada. So I'm wondering, is there anything out there that could give us a little bit of hope with slowing down the disease?
I don't know of any pharmaceuticals that can do that, but I would suggest like overall health be the best way to approach it. So just because you have dementia doesn't mean you shouldn't be working on improving your health, and a healthier person and a healthier brain is going to be positive no matter what. So while that's not going to reverse the condition, it might lead to better health outcomes and better quality of life. So keep thinking about how can we best maintain our health and our brain health. That might be the best way to kind of slow things down and make everyone live better.
Thank you.
One more question, I've been told.
Hello, Dr. Armstrong. Just wanted to thank you for sharing all this information with us. One thing we had talked about in our roundtable discussion was the fact that a lot of the factors that you were discussing have an increase in incidence in the last few years. And what I was wondering is there any collaboration that you're having with other agencies, other societies, such as like Diabetes Canada, in order to work together in combating these risk factors?
Not that I'm aware of at this level, but we definitely have to start, right? Because you have recognized that there's this large overlap. So for sure, for brain health, heart health and brain health are basically equivalent. So should we be doing extra effort to try to address them from different angles, or should we try to come together and try to tackle these issues across? Because many of these factors that we're talking about for risk factors for dementia are risk factors for other things as well. So what's the best, most effective and efficient way to do it is how we should get forward. So hopefully we'll collaborate with some of these other organizations to maybe come together and get a better sense of how we can best address it using as little resources as possible with the greatest effect.
Thank you.
I'm sure plenty of other questions are swirling through our minds. I'm pleased to say Josh is joining us for the day. So thank you, Dr. Armstrong, for being our keynote this morning. One more Nova Scotian round of applause for him. Thank you.